Patient is evaluated for gait disturbances over the last 1.5 years. She has also been experiencing difficulty concentrating and lack of interest. She has recently began experiencing urinary incontinence. Patient has a history of traumatic brain injury. Which of the following is the most likely diagnosis given the CT? Now let's go over hydrocephalus really quickly. Now normal CSF flow is going to go from the lateral ventricles into the third ventricle through interventricular foramen of Monroe. From the third ventricles, the CSF is then going to reach the fourth ventricle through the cerebral aqueduct. Now finally, from the fourth ventricle, CSF is going to flow to the arachnoid granulations through the foramen of Luschka and the foramen of Magendie. Now, normal pressure hydrocephalus, also known as communicating hydrocephalus, is going to occur when the CSF is not going to be able to flow from the fourth ventricles into the arachnoid granulations. So the arachnoid granulations are not going to be getting the CSF. As a result, there's going to be a backup of CSF, and so the ventricles are then going to be filled with CSF, and then they can dilate. If you go back to the question, we see the ventricles being dilated. And when these ventricles dilate, they're going to compress or disturb the periventricular fibers that are going to be running along. And when it does that, patients can experience cognitive symptoms like difficulty concentrating and lack of interest. They can also have urinary incontinence over time. But the initial symptoms that they usually have are going to be gait disturbances. So gait disturbances are going to be a earlier sign of normal pressure hydrocephalus. And their gait is going to be they're going to be taking slow and short steps when they're walking. So the answer is going to be normal pressure hydrocephalus. Now it's not going to be non-communicating hydrocephalus because with non-communicating hydrocephalus we have an increase in intracranial pressure, and that increase in intracranial pressure will result in a headache as well as nausea and vomiting, and these symptoms our patient does not have. Also, the symptoms have been going on for over 1.5 years, and normal pressure hydrocephalus can be commonly progressive. And it can be either idiopathic or due to a traumatic brain injury, and our patient has a history of traumatic brain injury. Answer choice A is frontotemporal dementia. Frontotemporal dementia most commonly presents with personality changes as well as aphasia.